Hello, everyone. Hi again, and thanks for tuning in. Gordon Causey, as always. And as you know, anyone who's watched my channel, Candy the Wonder Pup expects her TREAT, which I have in my pocket or somewhere. There it is. This one. Shake, lay down, speak, speak. That's better. There you go. And that buys me peace, as I always say. All right, let's cut right into it. Mask mandates are coming back. Put this under the rubric of forewarned is forearmed. It's already starting in the United States. I'm going to read an article that was published just a few hours ago. Right now, it is August 24th, very early in the day of Thursday, August 24th, 12:36 a.m. And an article came out in CBS News. This came out August 23rd, so just yesterday at 6:30 in the evening, 6:29. I'm not linking it because of Bill C-18. I don't know to what degree I'm allowed to share news articles as a Canadian. I've talked about that before. I'm not going to talk about that tonight. But the headline reads, as COVID cases flare, some schools and businesses reinstate mask mandates. I'll read just a little bit. A familiar pandemic-era safety measure is making a comeback as new COVID-19 variants surface and cases of the disease flare in some parts of the U.S., mask mandates. The number of COVID-19 cases has climbed for several weeks, with health authorities saying they're tracking the spread of 3 new variants. As a result, some businesses and other institutions are again requiring people to wear masks, which have proved an effective tool for slowing the spread of the virus. According to whom, but leave it alone. Like vaccine requirements, cities and states have widely dropped mask mandates as COVID rates have dropped since peaking in 2022. In February, for example, New York State dropped a requirement that face coverings be worn in healthcare settings, in line with guidance from the Centers for Disease Control and Prevention, after most other local businesses had already nixed mandates voluntarily. Morris Brown College in Atlanta this week announced that the small liberal arts school is reinstating its mask mandate for 2 weeks. Does that sound familiar? 2 weeks to flatten the curve, citing COVID cases among students. As of Tuesday, the school required that all students and staff members wear masks, according to a statement from college president Dr. Kevin James. The college is also imposing restrictions on event sizes, including parties, and is resuming efforts to trace infections. Just a small little liberal arts college in Morris Brown College in Atlanta. The article goes on. There will be no parties or large student events on campus for the next 2 weeks. Again, there's that 2 weeks, the school said. The college is also asking students who test positive for COVID to isolate for at least 5 days and to attend class virtually while in isolation. The latest CDC data shows that COVID-19 hospitalizations are up 30% across Georgia, driven by the spread of new variants. In California, and now it flips to California. In California, with cases of the virus rising in Los Angeles, movie studio Lionsgate is reinstating an in-office mask mandate in its Santa Monica headquarters. Deadline first reported. Lionsgate said a number of employees had recently tested positive for COVID-19, according to the report. And then I didn't see it reported in that article, but I've read as well that in Washington state, healthcare facilities are going to be requiring masks again. It may already be in place. And this is the way it starts. It starts in just select locations and then it spreads. So I'm here to tell you, I'm in Canada, as most will know, but it's going to come up here too. and it will spread. They're saying that COVID case numbers are on the rise. We are now we're coming up on the fall, and climate change notwithstanding, which everyone should already know my opinions on global warming and climate change, but global boiling and all that other stuff put over here, winter is coming. We are going to have snow this winter, and it is going to get cold, and the humidity in the air is going to drop. The air is dry in the winter, and that is when people get sick. Talk to anyone who works in the healthcare industry, specifically who work in hospitals. They will tell you that hospitals get inundated during flu season. You can go back to 2016, 17, 18, 19, before COVID came along, and there were articles in mainstream press like CBC, CTV Global here in Canada, reporting on hospitals being absolutely inundated with flu patients to the point where there are no beds available. I read one article from 2018-19, that flu season, about a hospital in Toronto having to treat patients sitting in chairs because there were no beds available anymore. Hallway medicine. Our healthcare system was always under strain, and the worst time of year probably is flu season, when socialized medicine in Canada, people, because I don't have to pay anything, so I've got I'm sick, I'm going to the hospital. I shouldn't be sick. I should never get sick. And everyone who goes into hospital for the longest time had to test for COVID. And if a test came back positive, we saw this in Ontario. They started finally reporting on it all the way, I think it was in 2021 or 2022, a year or 2 years into the supposed pandemic. They started to report on the number of people who were tested positive. We have 1,800 patients who tested positive. How many are being treated for COVID? And it was like half. Half the people going in weren't in there for respiratory type viral symptoms. They were in for a broken leg, to get stitches, whatever, but they tested positive, so they counted them in with the COVID numbers. And welcome to rinse and repeat. Now we're going to see the numbers going up, ramp up the panic porn, ramp up the fear, get the COVID Karens and Carls, the branch COVIDians, all losing their minds, and people are going to start screaming for their masks to come back. I know in my little corner of southeastern Ontario, I live in a very rural area, small town, not even 15,000 people. And the median age in this area is probably somewhere in the neighborhood of 60 years of age, meaning half the population is seniors or 60 plus, half are younger. And in my area, I would put the number of people wearing a mask when you go into a large indoor setting, like a grocery store, for example, I would put the number of people wearing masks at under 10%, maybe, not 10% at most, maybe 5 to 10%. 9 out of 10 people are no longer wearing masks. However, those that do wear masks are convinced that they have an ironclad degree in epidemiology, and that they know because they read some expert somewhere, or they read that article in CBS News that just puts it out there saying they're proven, when there are countless experts out there who challenge that assertion, that, well, I put it under the guise of propaganda, because I still recall very well the Annals of Internal Medicine published a peer-reviewed publication, published the results of a study conducted by McMaster University, which is one of Canada's leading medical schools. And they looked at a meta-analysis of over 100 years worth of studies into masking, randomized control trials, laboratory experiments, et cetera, et cetera, et cetera. And they looked at 100 years worth of research into masking, and the conclusion that they drew was that they said there is no direct evidence showing that masks have any impact on reducing viral spread or in protecting the people who wear them or others. No direct evidence. That's from the Annals of Internal Medicine, a paper published by McMaster University. Now, in that article, they still recommended masks. They said, however, notwithstanding that there's no direct evidence showing that they have any benefit, we suggest that the possibility of a modest reduction in transmission likely outweighs the potential for harm. And news outlets, bogus news outlets like yellow journalism that we have on steroids in Canada with CBC, CTV, and Global, they latched onto that statement about them still recommending them, notwithstanding the lack of any direct evidence. They latched onto that and said, McMaster team recommends masking as a proven tool. Well, read the article. They said there is no proof in the article, but that's the quality of journalism in this country. So mask mandates are coming back, and it is going to be slow. I'm not saying it's tomorrow. I'm not saying it's next week, although I expect we're going to see as the days and weeks roll on, within a month, you're going to see it pretty much. One of my least favorite words, ubiquitous. It's going to be everywhere. And how to respond. The words "do not comply" come immediately to mind. I have to admit, during the previous, I think we had mask mandates in Ontario until around March, April of 2022. And did I comply? I considered my compliance to be somewhat passive aggressive. I found this. I have it sitting on a table. Things dirty as sin. And it's just a little plastic thing, and it has a little chin rest, so it sits off your face. And there, with loops that secure it. I'm not even wearing this anymore. I mean, people would confront me on this, not often. I think I'm fortunate in that I'm 6 foot-ish. I'm just under 6 foot tall. You used to be 5'11" 3/4. Welcome to older age. Your discs in your back start to shrink and you lose height. I've lost a quarter an inch, but I'm 5'11", 5'11 and a half. Decent sized guy, the goatee, the shaved head, and I think people get intimidated. And so I would not be confronted. It did happen on occasion where people would say, they'd complain about my mask, and I'd